Welcome to the Deep Dives, where we try to cut through the noise and really zero in on what matters. Today, we're plunging into the pretty fascinating world of medical tourism. People traveling often across borders, sometimes even within their own country looking for healthcare. It's a trend that's really taking off, driven by maybe a search for specialized care or sometimes big cost savings, or even getting access to really cutting-edge tech elsewhere.
Exactly. And our mission today really is to unpack the key barriers that might be holding back the growth of medical tourism around the globe. We're drawing on insights from a recent scoping review, which is basically a big comprehensive look at all the research out there to see the patterns, the critical issues, and crucially, we want to connect these findings to, real lessons, especially for a place like Indonesia, which seems to have huge potential here. It's more than just healthcare, really. It touches on economic growth, international links.
Okay, right. Let's unravel this then. When you look at these sources, what really stands out as the biggest roadblocks? What's holding medical tourism back?
Well, first off, when we talk about medical tourism, you see it's huge in Southeast Asia. Places like Thailand, Malaysia, they're big players, mostly because it's cost effective. Then you've got the developed countries, the US, Japan, South Korea. They excel because of their really advanced medical technology. And Indonesia, interestingly, has these certified hospitals, amazing tourist attractions. It's kind of sitting on a gold mine, you could say, but it hasn't quite tapped into that potential yet.
Hmm. Okay. So if we're breaking down what's actually holding things back, what's the first sort of major category you see?
Yeah, we can basically split the challenges into two main buckets: internal factors and external factors. Looking internally first, the people side, human resources, that comes up as a really primary obstacle. I mean, think about it. Language barriers, maybe staff not having enough cultural competence, or just needing more specialized skills. That can absolutely make or break a patient's experience.
That totally makes sense, the human touch. But okay, here's where it gets really interesting for me. Beyond the people, what about the less obvious internal stuff? You'd think technology would just be a straightforward advantage, right? But were there hidden issues there?
You're absolutely right. Tech is key, but it's often the application of it that's missing. Some regions just lack, enough digitalization or the really cutting edge equipment. And pricing, oh, that's a real double-edged sword. Price transparency is a massive barrier. Patients are often really confused. Imagine trying to compare costs for a complex procedure. It's not straightforward. We see concerns in places like, say, Iran about unclear pricing, and that erodes trust. But it's not always about things being too expensive either. High service costs might be an issue in, like, the UAE, a developed area. But in many developing nations, the care is actually more affordable. So the issue becomes clarity, predictability, not just the price tag itself.
Wow, that's a fascinating distinction. So it's less about the raw number and more about trusting what that number means.
Oh,
Okay, got it. Now, stepping outside the hospital walls, what external factors are really playing a big part here?
absolutely. The environment outside the hospital is critical. Policy and regulation, huge hurdles. If government support is inconsistent or the legal frameworks aren't clear, like problems seen in South Korea and Turkey that can really stifle growth. A really striking example: Indonesia apparently has high import taxes on medical devices, which pushes up costs. That's completely different from Malaysia, where they use tax incentives, making things like CT scans much more affordable.
Wow, okay, so government policy has a very direct impact. What else externally?
Well, then there's all the supporting infrastructure. It's not just about the clinic. Think about weak hotels, difficult transportation, or maybe a lack of those dedicated medical travel facilitators, MTFs. These are agencies that help smooth out the whole process. You see issues perhaps with unregulated brokers, maybe like in Iran, versus the really comprehensive support system you might get from a major hospital like Bumrungrad in Thailand, which even has an agent right there in Indonesia. And finally, you can't ignore the fierce competition from established hubs like Singapore, plus, major economic shifts. The pandemic, for instance, apparently caused something like a 70% drop in medical tourists. That hits travel, costs, everything.
Wow, nearly 400 million US dollars a year leaving Indonesia just for healthcare abroad. That figure really hammers home the economic point you made earlier. So for you listening, and maybe for countries like Indonesia trying to get a piece of this pie, what's the bottom line here? What are the key takeaways?
Yeah, for Indonesia, especially with that estimated US $385.7 million flowing out, mostly to Malaysia, this research offers a pretty clear roadmap. For the hospitals themselves, it points towards improving HR, yes, but also management, getting the right tech, upgrading infrastructure, and crucially making pricing really clear and consistent. And for the government, It's about getting policies aligned, aiming for economic stability, boosting hospital competitiveness, maybe through those tax incentives or easier visas, and really beefing up that supporting infrastructure like travel agencies and transport links.
So we've covered quite a bit there. The internal challenges from people and tech and pricing, and then these big external hurdles like policy, infrastructure, and just sheer competition. It's a complex picture shaping medical tourism.
It really is. And while the specific challenges might look a bit different from country to country, the core strategies to tackle them seem pretty consistent. You need strong collaboration, good strategic planning, and fundamentally services that are truly focused on the patient.
Okay, putting it all together, thinking about all these moving parts. If you personally were looking for medical care overseas, what's maybe one non-medical factor completely aside from the cost that would be absolutely essential for you to consider before making that trip? Something for our listeners to think about.